Many children under the age of 3 get ear infections, and adults don't seem to get ear infection. Is there any reason for that?
Sure. Most of the predisposition for ear infections in children comes from the orientation of the eustachian tube. The eustachian tube in children is the tube that ventilates the middle ear space, and in adults it's positioned at a 45-degree angle into the back of the nose. In children, the positioning is more horizontal, making access for bacteria from the nose much easier, and also not allowing drainage to occur as easy as it would in an adult. As you get older, the eustachian tube matures and goes from a horizontal position to a more vertical position and functions better. Therefore, most kids outgrow their ear infections, and that's a common term that's used, but in fact what's happening is their body's maturing and the eustachian tube is ventilating the middle ear space better.
Is there any reason why the body does that and it changes? Is there any anatomical justification?
It has to do with the growth of the midface, and as the child grows, the midface enlarges, the eustachian tube descends, and the musculature on the eustachian tube also is allowed to open the eustachian tube more clearly to allow drainage from the middle ear.
Knowing that structural situation, it would be smart not to feed the kid lying on the back or let the kid go to sleep with the bottles if you want to reduce ear infections?
Correct. There are some studies that show that feeding a child with a bottle in the mouth, laying on the back, can cause reflux of those feeds into the eustachian tube and can predispose to ear infections. It can also cause some inflammatory swelling around the eustachian tube, which would then close it off more easily.
You mentioned reflux. If a baby has reflux, are they more prone to get ear infections?
They are. There are some studies which show that reflux into the nasopharynx, that is the back of the nose, can cause irritation to that same structure and predispose them to ear infections more than a child that does not reflux.
So sometimes if you control the reflux, you might reduce the number of ear infections?
That's correct. That's correct.